Okay, I'm going to just provide a very brief update on two projects that we've started in the work package 3. So this is the social prescribing and microeconomics package. These are pilot studies. We have big plans for them moving forward, but I'll just show you where we're at with them. So the first study I'm going to talk about is group singing for dementia. This is taking place in assisted living and long-term care facilities. And the second study is group singing for breathing disorders, and it's through a social prescribing pathway. So the first study we're looking at dementia. So this is taking place in, there's two, well, I'll start with the who. Mild to moderate dementia in assisted living and long-term care and their caregivers. What? It's a singing program. Could you have guessed? So it took place in a long-term care facility. It's brand new. It's publicly funded. It has over 600 beds in Mississauga. And Amica on the Avenue, which is an assisted living center in Midtown Toronto, it has about 60 suites and a much higher socioeconomic status there. Their average age at Amica is over 100. Yeah. And the questions we're asking here is, the first one is to understand the impact of the singing program on the psychosocial well-being of the residents, as well as for the team members and the caregivers that are supporting them. And the second is to conduct a cost-benefit analysis for the singing program. So the design, we have the micro test battery here. So this is the before and after a single singing session. With dementia, we had to modify it. So we basically just asked them on a visual analog scale about their mood, their social well-being, their pain, and their energy levels. We used the heart rate variability monitors, and we took their saliva using the Salavette technique. And then we had observational data. We're going to be requesting their chart data. So the team members that are taking notes every day, we're going to be comparing days where they had choir and days where they didn't have choir. We're going to be asking the caregivers about their burnout and stress levels on days that there's choir and days that there's not choir. And then we're running caregiver interviews. So we have some very preliminary findings just on the visual analog scales. So this is the residents themselves. So you'll see we have Amica and Wellbrook Place represented. The green is the pretest and the blue is the post-test, and I collapsed across all of our different times. But we're seeing, so there's no statistics run on this. I just made graphs for you today. I got this data yesterday, hot off the presses, like Dawn said. But we see the expected patterns across the 4 different outcomes here. So this is really promising, and we're hoping to have a bigger sample size and more complex statistics in the future. The economic analysis will take into account the staff burnout, the chart data, so the incident reports, falls, requests for assistance, and the amount of time that caregivers give to those requests. And so we'll be looking at the staffing costs and the psychological costs on the staff. We have some caregiver quotes, but maybe I will just skip through it because of time and we want to go eat. Okay, so the second study is this is the social prescribing pathway. This is for individuals living with, the original intention was COPD, but what we had actually was individuals with a variety of different lung challenges, breathing challenges. We had asthma, we had long COVID, and there was one person who just decided that they had trouble breathing and joined the choir too. So this takes place at the Chigamit Community Health Center. Jane is going to tell us a lot more about the context, but it's a health center that, oh no. Okay. It's a health center that brings together allied health professionals. So there's lung specialists, there's doctors, there's social workers, and all the individuals working at this health center knew to refer their clients that had lung disease to the choir. And so, you know, the same types of research questions, we wanted to investigate the effect of the singing program on breathing health and psychosocial well-being, and to conduct a cost-benefit analysis. We used pamphlets in the doctor's offices as well, so that people who are sitting waiting for their doctor could see that singing is for them if they have breathing trouble. The design, so here we had the micro test battery and the macro test battery. So again, the micro is happening before and after singing. The macro is happening before and after a 12-week session. We are also accessing health records where we're going to gain access to spirometry, hospital visits, partial hospital visits, and we'll run qualitative interviews on the participants. Again, some preliminary findings here. So on a questionnaire that for social connection, we asked for, on a Likert scale, 4 different questions. How much do you trust, feel connected, and feel similar to other members of the group? This is a Likert scale for shortness of breath. So we're seeing a decrease after a single singing session. And perhaps my favorite finding, we're seeing a decrease on anxiety from 38 to 12 after singing. So I'm excited about that finding, and I'm excited to explore it more when we have more data. The economic analysis here, we're going to look at the quality adjusted life years because we'll be taking the quality of life measure before and after the 12-week program. And again, the health records are going to help inform this economic analysis. So some next steps, there are 35 Amica residents across Canada, and there's over 600 long-term care facilities across Ontario alone. So surely we can collect more data. If we can do it in one place, we can do it in more. So I'm working right now to draft a report, once we have all the data analyzed, to draft a report to the homes that I worked in, to help me advocate to be spreading this across the different homes in Ontario and beyond. So yeah, maybe by next year I'll have some more data to share, but this is just an update on the work package 3. And now I'm gonna, does anyone have questions before I pass it off to Jane? I know I went through it really fast, but I'm trying to be mindful of time. Moving on.